Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we look at health not as isolated symptoms, but as interconnected systems that change quietly over time. Because behind every scan result, behind every mild back pain, and behind every gradual loss of strength in the body, there is often a deeper process unfolding silently underneath. And today's topic is osteopenia, what many people casually label as just aging, a phrase that sounds harmless but often hides an important warning from the skeletal system. People begin to notice mild back discomfort, slightly reduced strength, slower movement, less confidence in physical activity, and they assume this is normal with age, so life continues. No sudden pain, no emergency, no obvious alarm. But bone loss does not work loudly. It works quietly, and that is where the risk begins. Because by the time fractures happen, the system has often been weakening for years. When the pattern begins quietly, osteopenia rarely starts with a clear event. It starts with a shift, less movement, less loading of the bones, less muscle strength, less sunlight exposure, less attention to nutrition, and slowly, bone rebuilding becomes weaker than bone breakdown. At first, nothing is felt, no pain, no limitation, no warning. But internally, the skeletal system is changing its structure. Bone density begins to drop gradually, strength reduces silently, fracture resistance weakens over time. And many people only discover this when a scan is done. A minor fall causes injury, height begins to reduce, or back pain becomes persistent. At that point, it is no longer mild bone thinning. It is a structural system that has been under long-term imbalance. What is happening inside the system? Now step back. Bone is not static. It is living tissue, constantly being broken down and rebuilt in a balanced cycle. But this cycle depends on multiple systems working together: hormones, nutrition, movement, vitamin status, muscle strength, metabolic health. When balance is maintained, bone remains strong. When balance shifts, breakdown exceeds rebuilding. And over time, bone density decreases, microarchitecture weakens, fracture risk increases. This process is usually silent, which is why osteopenia often becomes visible only after damage has already started. The doctor's perspective, it is rarely one cause alone. From a medical standpoint, osteopenia is never just low calcium. It is a multi-system condition. Common contributing factors include aging and hormonal changes, menopause and reduced estrogen, low physical activity, vitamin D deficiency, poor nutrition, smoking and alcohol use, long-term steroid use, chronic disease states, genetic predisposition, but importantly, some patients develop bone loss even without obvious risk factors on the surface, because internal metabolism plays a major role. That is why osteopenia is often the early phase of a broader skeletal decline, not yet osteoporosis, but already a warning stage. If ignored, it may progress to fragility fractures, spinal compression injuries, loss of mobility, chronic pain, reduced independence. And many of these outcomes are preventable with early action. Now bring in the nursing perspective. The nursing perspective. Daily life is where bone health is built. Bone health is not maintained in hospitals. It is maintained in daily life through repetition, through habits, through movement patterns. What often contributes silently to bone loss includes sedentary routines, fear of exercise, poor mobility, poor dietary consistency, missed supplements, poor rest at home, low sunlight exposure. And these do not feel dangerous at first, but over time, they reshape skeletal strength. Supportive daily practices include regular walking and movement, safe strength-based activity, adequate sunlight exposure, balanced hydration, fall prevention at home, healthy weight maintenance, routine follow-up care. Because bone strength is not built in a moment, it is built through consistent mechanical loading over time. The pharmacist's perspective. Medication can influence bone health. Now bring in the pharmacist's perspective. Some medications, when used long-term, can influence bone metabolism. These may include long-term corticosteroids, some anti-seizure medications, excess thyroid hormone replacement, certain chronic acid suppressant drugs. The issue is not only medication use, but unmonitored, prolonged use. Common challenges include incorrect calcium supplementation timing, missed vitamin D intake, unregulated horrible products, stopping prescribed therapy prematurely, lack of monitoring in long-term treatment. Pharmacists help ensure safe supplement use, correct dosing schedules, monitoring of side effects, drug interaction safety, long-term adherence support. Because bone protection is not just about taking supplements, it is about using them correctly within a larger treatment system. And not every patient requires the same approach. Some improve with lifestyle alone, others require medical support. That is why proper assessment matters first. The dietitian's perspective. Nutrition builds structure over time. Now bring in the dietitian's perspective. Bone is structural tissue, so nutrition is not secondary, it is foundational. Repeated nutritional gaps weaken skeletal integrity slowly over years. Low intake of calcium, vitamin D, protein, magnesium, micronutrients can gradually reduce bone maintenance capacity. At the same time, patterns such as high sugar intake, processed foods, excess alcohol, poor meal balance, increased metabolic stress that indirectly affects bone strength. Supportive nutrition includes calcium-rich foods, adequate protein, leafy greens, nuts and seeds, vitamin D support, balanced whole foods, steady hydration. But the key principle is consistency. Bone health is not restored through short-term diets. It is maintained through long-term nutritional patterns. Now step back and see the full system. Movement decreases, muscles weaken, hormonal balance shifts, nutrition becomes inconsistent, bone rebuilding slows, density reduces gradually, structural strength declines, fall risk increases, fracture vulnerability rises, and all of this happens quietly. No loud symptom, no sudden alarm, just slow internal change over time. That is the nature of osteopenia. Final point. Not every bone change is just aging. Sometimes the drivers include hormonal imbalance, vitamin D deficiency, sedentary lifestyle, metabolic disease, chronic inflammation, medication effects, poor nutrition, muscle weakness. And the difference matters because osteopenia is not the end stage. It is a warning stage, a window where intervention is still highly effective. So do not ignore early bone density changes. Do not normalize increasing weakness as just age, and do not wait for fractures before taking action. Observe the pattern, strengthen the system, correct the underlying drivers early, because the goal is not only to treat bone loss, it is to preserve mobility, independence, and quality of life before structural damage becomes permanent. And that is the essence of preventive care. For consultation or inquiries, call or WhatsApp +233 208 700 and 2347